This is Carol. I want to give you an idea of what to expect for the skills test and exactly how that's going to work. Today, you will all be put into the state database, which is called TMU. The email is ut.tmuniverse.com. Sometime today, you will get an email, and it has to match your driver's license, the name on it. And you'll get this email from TMU telling you to complete your account. So you'll put in your birth date and your social security number and all the stuff they ask for, but you won't be able to sign up for the test or schedule anything until after you're done with the class, the lab, and the final. So a lot of you will be done on your next lab. Once you're done with the final class and lab and you've passed your test in the class, you'll get a second email and text from PMU telling you that you can sign up for your test. You have to pay for the test before you can actually see the schedule and sign up. So there's a little cart, and you'll put your test in the cart and pay for it, and then you can sign up. How quickly you sign up, it depends. There's multiple testing sites throughout the state. There's Salt Lake, and Ogden, and Kaysville, and Lehigh, and Tooele, Logan. They're all around. So how quickly you can test depends on whether you're willing to drive to Kaysville or Lehigh, or if you're only willing to go to Slick and you're only willing to go on Tuesdays. Usually people can get in pretty quickly if they've got some ability to work with their schedule. I'm going to go through all the skills with the video and let you know what people are missing. So I would get out your skills handbook and follow along and make notes about what people are missing. So when you take the state skills test, there are 22 skills, and you'll get 5 random skills. You don't know what the skills are. We don't know what the skills are. You'll just get what you get. Each skill is a separate entity. So for each skill, you'll have to introduce yourself, your name, explain what you're going to do, tell them your title, the beginning and ending procedure. So don't forget that each skill is a separate entity. They will have the room set up like our lab here. There'll be a bed. All the equipment will be on a shelf or a table, and they'll tell you where it is, and they'll orient you to the room, show you how to use the bed. There'll be a dirty area. They'll say dirty, and that's where you'll put the bedpan or the graduate if you get output. If you make a mistake while you're doing a skill, you can say, I made a mistake. Can I start over? I forgot to put the brakes on the wheelchair, or I forgot to put the non-skid footwear. And they will let you redo it. Once you leave, once it's over, there's no do-over. If you don't pass, you'd have to pay and retake it. So if you make a mistake, try to correct it immediately. You have to wear scrubs to your skills test, or they'll send you home. You have to have a picture ID. You have to have your hair back. You have to have clean shoes. We'll have a calculator there. We'll have a watch there with a second hand because you can't use an Apple Watch or your cell phone. First skill is hand washing. Our pass rate for hand washing is 100%. Maybe once a year somebody fails hand washing, and it's usually something totally random. They got all the hard skills right and somehow managed to fail hand washing. The things that people miss the most is not washing their hands for the 20 seconds, and they are going to time it, not cleaning the wrist, or not pointing their hands down towards the sink, or touching the sink after they wash their hands, or taking the paper towel and putting it from one hand to the other. So now you've touched the dirty paper towel with your clean hand. So once you dry off your hands, you hold the paper towel in the one hand and throw it directly into the garbage. Second skill is blood pressure. We've had a really good pass for blood pressure lately, but there have been times when people have struggled with blood pressure. You have a plus or minus of 10 millimeters of mercury, which means if your blood pressure is 140/70, you could say anywhere between 130 and 150 or 60 and 80 and still get it right. So it's a pretty big margin of error. But people get it wrong. We will practice blood pressure with you and pass you off and make sure that you know what you're doing. Make sure that if you are struggling, that whatever you do, you don't guess. Because if you guess with us and you happen to get it right, we're not going to know. If you're struggling, make sure that we know so that we can help figure out what the problem is so that you don't fail this. Routinely, though, people do forget to do hand hygiene when they do blood pressure. Not sure why, but you still need to do hand hygiene.
Hi, we're going to do skill number 2, blood pressures. And for this skill, you don't have to do the beginning and ending procedures, but you do have to do the beginning procedures, sanitize your hands, and then at the end, they just have you sanitize your hands, and I'm not sure why. But anyway, if you do the beginning and ending procedures, that is good. So we're going to do a blood pressure, and I just wanted to show you. Let me just do hi Linda.
Hi.
I'm Claudia. I'm your CNA for the day, and I'm going to take your blood pressure.
Okay.
Let me just sanitize my hands, okay? And let me just show you the blood pressure cuff. The cuffs they have some stitching along the side here, and then there's a rubber bladder in here. And we want that rubber bladder so that it kind of encircles the arm just like right in the middle, and there's some little arrows here on the cuff. One says right, one says left, and this is her left arm. So I want the arrow to be, this is her right arm. I'm dyslexic when I'm doing blood pressures. So the brachial artery is on the inside of the arm at the crease, and so not in the middle. There's a vein in the middle, but you really can't feel a pulse there. Oh, you've got a lovely brachial artery. Okay, so the cuff also has a gauge, and this gauge goes from 0 to 300. The long lines are 10, and the little lines are 2. And when you're reading a blood pressure reading, you're going to read it in even numbers. For example, 122/74. You're not going to say 183/69. So you'll do even numbers. Then there's also a bulb and a dial, and righty-tighty, lefty-loosey. So you want to make sure there isn't any air in the cuff. Then you're going to turn the dial to the right, but not too tight, because if you get it too tight, it's hard to get undone. So we're going to place the cuff on the upper arm with the arrow over. This is right arm. And we've got her brachial artery here, and you want to just wrap it around the arm, nice, and you don't want it too tight, but then again, not too loose. And the dial, there's a little piece of fabric here, and you can just put it in like this. So I'm going to the stethoscopes. We already showed you how to use the stethoscopes, but just make sure that the earpieces go inward just a little toward the nose. You're not going to put it in backwards because you can't hear as well. You want it toward the nose because the ear canal goes toward the nose. This is a double stethoscope. This is what they're going to be using at the state test, is the double stethoscope. So I'm just going to use half of it, but you want to make sure that I've alcoholed things. So you want to clean off the earpieces as well as the diaphragm. And then you're going to put the blood pressure cuff in your ears and just tap it to make sure it's turned on, and it is. So I'm going to take my cuff and I'm going to put my fingers over it this way. This is, and just hold it firmly on the arm. Now I'm going to pump the cuff up to at least 160. The state says between 160 and 180. So I'm going to go ahead and pump it up to 180, and then I'm going to slowly release the dial, and the needle will start to bounce a little bit. And then first sound I heard at 126, Last sound, 54. And then you release it all the way to 0. So Linda's blood pressure was 126/54. Now I'm going to take the cuff off, and you always wrap them up so that the cuff goes over the dial. And then I will sanitize my hands. And even though it doesn't say in the skill to leave the call light and fresh and call light and fresh drinking water, I'm going to anyway. So here's your call light and fresh drinking water. Okay, that's blood pressure.
Interestingly, the last 2 months, pulse and respiration has been our most missed, most failed skill. We had 10% of people who got pulse and respiration fail, which is only 3.5 people, but still, that's a lot of people. So for pulse, you can be off by 4 above or below, and for respiration, you can be off by 2 above or below. You're going to count for 30 seconds and multiply it. You have to be able to read an analog clock, which we have a lot of students who learned to read an analog clock in 3rd grade, but they haven't done it since, so they don't know how to know that from 12 to 6 is 30 seconds. So if you need help figuring out how to read an analog clock, please tell us and we can help you one-on-one. If you have problems feeling, if you've got neuropathy in your fingers or something, for pulse, you can actually do an apical pulse. Just like blood pressure, we're going to pass you off individually on pulse and respiration. So don't guess. If you're struggling, please make sure that we know so that we can figure out what your problem is and help you so that you can be successful on the state test.
I'm going to count respirations on Linda now. So hi, Linda.
Hi.
My name's Claudia.
Hi, Claudia.
I'm your CNA for the day, and I'm going to do your vital signs, pulse and respirations. I'm actually just going to do her respirations, but we don't tell them when we're counting respirations because they'll either laugh or stop breathing. You can control your respirations. So what we do is we pretend we're counting the pulse, but we're going to go ahead and look at the chest. 1 breath in, 1 breath out is a respiration. So 1 inspiration and 1 expiration is a respiration. We want to know how many times she breathes in and out in 1 minute. And we can count for 30 seconds with our watch with the second hand. You want to start when the big hand is on the 12 or the 6 so you don't lose time and track of where the big hand was. And then we can multiply it by 2. For the state test, they'll have you write down the pulse and respirations. And once you write it down, that's your final answer. If you want to do it again, you can, and that's fine. So, okay. 1, 2, 3, 4, 5, 6. So I counted her breathing 6 times. I'm going to multiply it by 2. That is 12. I'm going to go ahead and sanitize my hands, and I'm going to write down 12. There we go. I'm going to count respirations on Linda now. So hi, Linda.
Hi.
My name's Claudia.
Hi, Claudia.
I'm your CNA for the day, and I'm going to do your vital signs, pulse and respirations. I'm actually just going to do her respirations, but we don't tell them when we're counting respirations because they'll either laugh or stop breathing. You can control your respirations. So what we do is we pretend we're counting the pulse, but we're going to go ahead and look at the chest. 1 breath in, 1 breath out is a respiration. So 1 inspiration and 1 expiration is a respiration. We want to know how many times she breathes in and out in 1 minute. And we can count for 30 seconds with our watch with the second hand. You want to start when the big hand is on the 12 or the 6 so you don't lose time and track of where the big hand was. And then we can multiply it by 2. For the state test, they'll have you write down the pulse and respirations. And once you write it down, that's your final answer. If you want to do it again, you can, and that's fine. So, okay. 1, 2, 3, 4, 5, 6. So I counted her breathing 6 times. I'm going to multiply it by 2. That is 12. I'm going to go ahead and sanitize my hands, and I'm going to write down 12. Here we go.
Antiembolism stockings, TED hose, compression stockings. For all of these skills, they're going to read you exactly what it says in the skills. Is going to how they're going to present it to you. So they're going to tell you to put the anti-embolism stocking on the leg that's marked with red tape. And we've got 100% pass rate for that. Like hand washing, about once a year somebody fails anti-embolism stocking when they got all the hard stuff right. Just make sure there's no wrinkles, make sure the heel's where the heel's supposed to be, and don't forget to introduce yourself. Because there's so few skills, so few different parts of this skill, if you don't introduce yourself and give your name and say what you're doing and do hand hygiene, it might be enough to fail the skill just because you forgot the beginning and the ending procedures.
Hi, Mrs. Lindsay. Oh, I love your hair. You got your hair done. It looks really nice. My name's Claudia. I'm your CNA for the day, and I'm going to put your TED hose on this leg right here, on your left leg. So let me use my hand sanitizer. And I've got your TED hose here, and I'm just going to roll it up. And the main thing is, when we put these TED hose on, we want the toe on the toe and the heel on the heel. And then you want to make sure it's smooth as you put it up the body, or up the leg. So anyway, so we'll just put the TED hose on, and then it looks like your heel's in the right place, the toe's in the right place, and then your knee will just fix so it's on the top. There. Okay, does that feel comfortable? It looks like we've got it nice and smooth. There's only one wrinkle, and I'm going to fix that. Okay, does that feel good on your leg? It does? Great. Okay, I'm going to sanitize my hands, and I'm going to leave you your call light right here and your fresh drinking water. Okay, anything I can do for you? No? Okay, thanks.
Ambulating with a gait belt, people are doing pretty well. Make sure that the residents' feet are flat on the floor. Make sure that the gait belt is pretty tight around their waist. Most people leave it really loose, and assist the resident to stand.
Hi Whitney, how are you doing today? My name is Claudia. I'm your CNA for the day, and I'm going to help you from the bed over to this chair using the gait belt. Okay. So I'm just going to sanitize my hands here, and then let's make sure the bed's down and the brakes are on the bed, which they are. Yeah, it's not going to move. And you have non-skid footwear on. You've got your shoes on, so perfect. And then I'm going to go ahead and put this gait belt around your waist, and then I'm going to help you walk over this chair. Okay, I guess I should do this first. All right, so the gait belt just goes right around your waist, and you want to make sure it's snug enough that I can fit my hands underneath it, but not too tight that it's going to be restrictive on you at all. So as you see, notice there's some teeth here. We're going to put the belt in next to the teeth, and we're going to pull it quite tight, just snug. And then you do it up just like a regular belt. And then if there's any extra, you can just tuck them under here. So I'm going to help you stand, and I'm going to hold the gate belt, and you can hold on the side or toward the back. So on the count of 3, we're going to stand up. 1, 2, 3. And then if she had a weak side, we would stand on the weak side. And we're just going to walk over to the chair here. And then you can turn around and sit down. And I want to make sure your bottom is to the back of the chair. It looks like you're there. And then your feet are flat on the floor. I'm going to go ahead and take the gate belt off. And then, are you comfortable there? Are you? Okay, great. I'm going to leave a call light here and some fresh water. So, do you think this will be enough for you to drink? There you go. And here's your call light right here. Okay, thanks, Whitney. You call me if you need me.
Number 6, ambulating with a walker using a gait belt. Same thing as the other gait belt. People aren't putting their feet flat on the floor. 25% of people aren't putting their feet flat on the floor. The gait belt's too loose. Make sure you lock the wheels on the bed. Make sure they have non-skid footwear. Make sure their bum is in the back of the chair. Remove the gait belt when you're done. And don't forget hand hygiene. Do not just leave them sitting there with the gait belt on.
Hi, Whitney. Hey. I'm Claudia. I'm your CNA for the day. And I'm going to help you over into this chair. And I know you have a little trouble walking. So we're going to use this walker to help you. But I'm going to stand by you and hang on to the gate belt as you walk over there. Okay. So let me sanitize. All right. Now we've got the bed flat. We've got your feet on the floor. You've got non-skid footwear, and I put the brakes on the bed. So we're going to put the gate belt around your waist. I know this last week you didn't even need a gate belt. I mean a walker, and today you're needing your walker. But that's okay. They're helpful. Okay, so we're going to get it tight enough that it doesn't slip up your body. And then what I'm going to do here, Whitney, is I'm just going to have this here. I'm going to help you stand, and then I'm going to help you hold on to the walker. So on the count of 3. 1, 2, 3. Okay, and then you just hold on to the walker here. And then we're going to walk over here. And then I'm going to put the walker here and help you sit down. There you go. And let's make sure your bottom at the back of the chair. It is. Take off the gate belt. Okay, are you comfy? Yeah. Okay, good. Now I'm going to sanitize my hands. And then I've got a call light for you and some fresh drinking water. And then you just call me if you need me. Okay.
Number 7, assisting with the bedpan. Nobody failed it the last 2 months, but 4% of people put the bedpan in backwards, so the wide part was between their legs instead of up by their bum. And 10% of people didn't raise the head of the bed. Think about being on a bedpan. Could you pee or poop laying flat on your back on a bedpan? You would seriously have to go to be able to do that. So make sure you set the bed up. And the bedpan's one of those weird ones because it's like half a skill. You put them on the bedpan, you take them off the bedpan, and then you don't do Precautions or empty the bedpan. Because all this skill is looking for is can you put them on and take them off the bedpan. It's not looking at Precautions. That's a separate skill.
Hi, Mrs. Smith. I'm Carol. I'm your CNA. I am going to get you on a bedpan. Okay? I've got you laying flat in the bed. Do some hand hygiene. Put on my gloves. So hard to put gloves on wet hands. Okay, I've got your bed flat, so I'm going to roll you over on your side and get you on this bedpan. Oh, I believe you're the one that's falling apart. Okay, on your side you go. I'm going to put your bedpan under. The wide part goes up to the top of the bum. Okay, there you go. Now I'm going to raise the head of the bed. that comfortable? Good. Okay, here's your call light. I'm just gonna step out here while you do your business. You're done? Okay, good job. You put the bed back down. Okay, I'm gonna roll you over on your side. Pull this bedpan out. I'm gonna take the bedpan over to the area they have marked at the state test that says dirty area. And I'm gonna set the bedpan there. And I'm just gonna leave it. Obviously in real life, you would do peri-care and take care of the bedpan, but this isn't real life, this is a test. I'm gonna take off my gloves. I'm gonna throw them in the trash. I'm gonna use hand sanitizer. I'm gonna give her her call light and her water. All right, Mrs. Smith, you let me know if you need anything. Bye-bye.
Brief change, peri-care for a female. There are a lot of steps to this. 25% of people aren't remembering to separate the labia majora when they clean. I'd say it, but nobody's going to remember to say that. Hi, I'm going to separate your labia majora, because that's just awkward. People aren't wiping clean to dirty. They're not changing their gloves. Make sure you wipe down both sides of the labia, starting with the urinary meatus. Brief change for male and female has this weird thing that in the middle of the skill, after you take the brief off, before you put the new brief on, you have to stop while the patient's on their side and change your gloves. Just remember, you just got to do it. Doesn't matter if you do it in real life, but for the patient passing the state test, you got to do it.
Hi, Mrs. Lindsay. My name's Claudia. I am your CNA for the day, and I am here to change your brief. I have my supplies here. I have an extra pair of gloves. I have a brief. I have some wipes. I have a garbage can. And I put my gloves on. It's a little hard to get them on after you just sanitize because my hands are just a little bit sticky, but it's all good. Okay, so first thing I'm going to do is I'm going to undo the tabs, and then I'm going to roll the brief down right between your legs. Now I'm going to clean you. So I'm going to take a wipe and I'm going to separate the labia and I'm going to go front to back. We always clean front to back on women. And then I'm going to take a clean part of the wipe and clean down the sides. Then I'm going to clean the upper legs. Okay, now I'm going to roll you onto your side and I'm going to wash off your bottom. So over you go. Whoops, you've got some troubles with your hips, I can see. Okay, there we go. So now I'm going to take a clean brief. And women, of course, everybody, we wipe front to back. And then I'm going to go ahead and wipe off your bottom. New part of the wipe. And then you can either put your wipe in the garbage can or you can put it right inside of the brief. You're going to roll it up. You're going to throw it right into the garbage can. Now I've got your new brief, and as you know, okay, but first I'm going to change my gloves. Whoops. So much to remember when we're changing briefs, I'll say. Whoops, you kind of rolled back a little bit, Mrs. Lindsay. But I'll put you back on your side. Okay, now I'm going to take this clean brief and I'm going to tuck it underneath. I'm going to get it right in the middle. And then I'm going to bring you back. And I'm going to take the brief and I'm going to put it in place with the tabs. Remember, the tabs are at the top in the back. This is quite a process, but we want to do it all right so that we get you nice and clean and have your brief on. Okay, now I'm going to go ahead and remove my gloves. I'm going to sanitize my hands. I'm going to leave your call light and your fresh drinking water right here by you. Here's your call light right here. Okay.
Change for the male, pretty equal to the women for pass rate, except wiping the penis from the tip to the base and using a clean wipe for each stroke. And again, you got to change your gloves in the middle of this skill.
Hi, Mr. Smith. I'm Carol. I'm your CNA. I am going to change your brief today. Is that okay? Okay, great. I'm going to put some hand sanitizer on my hands so they're nice and clean. Flip them around a little bit because it's hard to put gloves on wet hands. Do you have a good day today, Mr. Smith? Woo! Okay. I am going to undo the tabs on your brief. I'm going to roll it down between your legs. I am going to take a wipe. I am going to clean around the tip of your penis. Then I'm going to take another part of the wipe and clean around the rest of your penis. And I'm going to throw that wipe away. I'm going to get another wipe. And I'm going to clean your scrotum. And then with a different part of that wipe, I'm going to clean your legs. Then I'm going to get a new wipe. I'm going to roll you on your side. Up, let me grab your arm. There you go. Okay. Now I've got this wipe here, or this. I am going to clean your bum, front to back and up the crack. Use a different part, got that all clean. I'm gonna roll this up in your brief. I'm gonna leave you on your side. I'm gonna throw your brief away. I am going to take off my gloves. And I'm gonna put on a new pair of gloves. Okay, I'm going to take my new brief, or rather your new brief. Make sure I've got the tabs on the back. Tuck that underneath you. I'm going to roll you over on it. I'm going to pull it up. I'm going to secure the tabs on both sides. Which is hard with gloves. Okay.
Thank you, that feels so much better.
I'm so happy. Now I'm going to take off my gloves. I'm going to put hand sanitizer on. I'm going to leave your call light and your water right over here next to the bed. Is there anything else I can do for you? No? Okay, you just ring if you need help. Have a good day.
Contact Precautions, 100% of people have passed it as of late, but 14% of people are forgetting to do hand hygiene. So you got to do hand hygiene for every skill. And when you don't, it's hand washing, and that's because you're washing your hands. But for every other skill, you've got to use hand sanitizer.
Okay, I'm going to put on my PPE, or my personal protective equipment. And for this skill, all they're going to have you do is put on a gown and gloves. We're not going to be putting on the mask or anything else, just the gown and gloves. So I have my clean gown, I have a pair of gloves, and one thing, we're not going to have to do beginning and ending procedures because we don't have a patient, but we do need to sanitize our hands before and after. So make sure you sanitize, and then you're going to take your clean gown, you're going to open it up, and you're going to put it on so that you put your arms in the arms. And there are ties on this thing, so you want to tie your necktie, and then tie your waist tie. And just make sure the gown comes all the way around your body so that it gets you all covered up. And then the most important thing, or one of the most important things here, is to make sure that the gloves come up over the sleeve, because we don't want any little critters crawling up your arm. Now, these are gigantic gloves that I have here, but they do come over the sleeves.
She's going to go do some veterinarian medicine after class.
Okay, now I'm ready. I'm going to go in and I'm going to take care of my patient, and then I'm going to go ahead and I'm going to undress. So you're going to take one glove by the palm and pull it off, throw it, or you can just keep it in your hand actually before you throw it in the garbage, and then take the other glove, cover it up, and then we'll just throw these gloves into the garbage. Okay, I'm going to go ahead and I'm going to untie my waist tie, and I'm going to untie my necktie. I'm going to go ahead and I'm going to remove one arm, then the other, hold the gown away from you, roll it away from you, and then you put it right directly into the garbage can, and then sanitize your hands, and we are done.
Denture care. Do this little tricky thing with the denture care where the supplies, they have toothpaste and denture paste, and you have to make sure that you use the denture paste and not the toothpaste. So that's a little tricky. And then when you put the dentures in the cup, after you're done cleaning them, 15% of people aren't putting water in the cup. They're just putting dentures in an empty cup. So make sure you put water in the cup.
Hi, Mr. Smith. I'm Carol. I'm your CNA. I am here to clean your dentures for you, okay? I'm going to put some hand sanitizer on, make sure my hands are nice and clean. And then I am going to put my gloves on. How you feeling today, Mr. Smith? Okay, I've got my gloves on. And I've got your dentures here. So I'm going to take your dentures over to the sink, and I am going to put a cloth on the sink because how much do these dentures set you back, Mr. Smith? Yeah, they're pricey. We don't want to drop them and break them. So I've got my denture sitting there, and then I've got my denture cleaner. So I've got a denture brush, and then there's two things in here. There's toothpaste and there's denture paste, and they're trying to trick me. I need to make sure I use the denture paste. So I'm going to turn my water on. I'm going to put denture paste on my denture brush. I turn my water on. I'm going to clean my dentures. I'm going to clean all the surfaces of them. Front, back, in between. I'm going to rinse them off. I'm going to fill up a cup with water. I'm going to put the dentures in the water cup. I'm going to clean my stuff up. Put that in the dirty clothes hamper. I'm going to take off my gloves. I'm going to perform hand hygiene, and I'm going to leave you your call light and your water. You need anything? Chapstick, you said? Why, I would be happy to put chapstick on you. Okay, anything else? Whoops, I guess I better do some hand sanitizer again. Okay. All right, you've got your call light and water. All right, you have a good day. Call me when you need me. Thank you.
Testing a resident, they're going to have a weak side. People are forgetting to use hand hygiene, and they're forgetting to use the clothes hamper. Make sure that you test the weak side first, and then when you're undressing them, you undress the strong side first. And if you forget that, just stop and think for a second about if you couldn't move one arm, how you would put the sweater on, that you would put it on the weak side first.
Hi, Whitney. Hey. How are you doing today? I'm Claudia. I'm your CNA for the day. And it looks like we need to change your hospital gown. So let me sanitize my hands. And then you do have a weak arm.
Yeah.
I notice you're having problems with this arm right here. Okay. Now, you can choose which you'd like to wear. Now, would you like to wear this lovely gown with little snowflakes on it, and it seems to match your eyes? Or would you like to wear this old t-shirt that I found in the DI bag?
We'll go with the gown.
Okay. All right. Okay. So what I'm going to do first is I'm going to untie your gown, and we always undress the strong side first, and then we're going to undress your weak side. Okay, I'm going to put this right directly into the clothing hamper. Okay, so now we're going to put this new gown on you, and we always dress the weak side first. So let me have this arm. Okay, and then here, you just let it fall. And then go ahead and put your arm in here. And then I'm going to go ahead. Do you want this tied?
Yeah.
Alrighty, I'll tie it up for you. Does that feel pretty good?
Yeah.
Nice and clean, huh?
Mm-hmm.
All right. Whoops, I got your hair in it. All right, so I'm going to go ahead and just make sure you have your call light and your fresh drinking water here. I need to sanitize my hands again. Whoops. Anyway, I'm going to put them right here for you. Let me sanitize my hands. So. Okay, all right. And I could have sanitized my hands first before leaving your call light and fresh drinking water. Always, if you're wearing gloves, we remove the gloves, sanitize, and leave the fresh drinking water and call light.
Emptying the down drain bag. This can be an automatic fail if you're off by more than 25 plus or minus when you're measuring the output. Make sure that you clean the tip of the spout with alcohol when you're done emptying out the urine, and don't forget to explain the procedure.
Down drain bag and record urine output. Candidate is asked to empty resident's catheter down drain bag into a graduate container. Then measure and record urine output. Output should be recorded in milliliters. Skills observer will indicate where the flat, dirty surface is located. A recording form is provided to document urine output measurement. A mannequin portrays the role of the resident. So I will now perform the skill. Hi, Mr. Jones. I'm Carol. I'm your nurse today, and I'm going to empty your catheter bag. How you doing today? So I performed my hand hygiene. I'm grabbing my paper towel and my graduate and my alcohol and my gloves. Maybe. I set my graduate on the floor on a paper towel. I put on my gloves. And then I empty the down drain bag into the graduate. Pull this little piece down. When it's empty, I wipe it off with the alcohol. I want to make sure this isn't touching the container. And then I put it back in the house here. Then I pick up my urine and I set it on a clean, flat, dirty surface. Well, it doesn't have to be clean, but on a flat, dirty surface. I take off my gloves and throw them in the garbage. I put on my hand sanitizer. I read this at eye level. There are 725 milliliters in here. I write down 725 milliliters on the intake output sheet. And because my hands are clean, I now give him his call light, his water, and make sure he has access to his cell phone. You have a good day, Mr. Smith. Let me know if you need anything else. Here's your call light. Thank you.
Putting the resident in bed, 10% of people didn't put them in an upright position. I'm not even sure how you can make that mistake because they're going to choke if you feed them laying down. 25% of people don't wash the resident's hands. You got to give them a hand wipe or a wet wipe to wash your hands with. And when I've talked to students, they go, well, they're laying in bed, so how can their hands be dirty? Well, they're laying in bed looking at their bum or putting their hands in their armpits, whatever. They're just, it's nasty. Make sure that you give them something to wash their hands with before you feed them. They're going to be touching their food too. And people forget to give them choices or offer water, so you need to ask them what they want to eat next. And make sure you offer them a clothing protector.
Hey, Mrs. Smith, I'm Carol. I'm your CNA, and I am here to help you eat lunch. Let me put some hand sanitizer on. Let's get your hands cleaned off, because
Oh, that would be great. Thank
who
you
knows
so
what
much.
they've been doing in there.
Yeah, my bum's been a little itchy, so it might be a little dirty.
Okay, let's make sure there's nothing underneath those fingernails.
Just some chocolate.
Okay. Would you like a clothing protector so you don't get your gown all messed up?
Oh, that would be great. You know, these gowns, they're just so beautiful.
All right, we have here today some chicken soup,
Ooh.
and we have steak, peas, and fries.
Oh, I hate peas.
You hate peas? All right, peas are off the table. So what would you like first?
I'll have some of that soup, please.
Okay. I forgot your water.
Oh, boy, that would
All
be
right,
terrible.
here's your soup. What would you like next?
Steak, please.
Okay,
Oh, thank you.
and some water. Okay, are you
Delicious.
done?
Oh, so full.
All right.
So full.
Okay. Let's wipe your
Excuse me.
mouth off. Let's take your gown off. Put that in the clothing hamper. Do some hand hygiene.
You are such a sweet nurse. Thank
Here's
you
your
so
call light, and
much.
here's your water, and you give me a call when you need something, and I'll be back when it's time for bingo, because I know you love your bingo.
Woohoo! Thank you.
Indwelling Catheter Care has a lot of steps. People aren't holding the catheter when they're cleaning around the meatus and when they're cleaning the tubing. Think about that. If you had a tube in your bladder with a balloon, would you want somebody yanking on it without holding it? No, you wouldn't. So make sure that you hold it down. 20% of people aren't securing the tubing to the thigh. You need to make sure you have that strap on it. And in the video, I didn't verbalize that the tubing was over the leg, but it was. But you need to make sure that the tubing's over the leg, and it's worth verbalizing that it's over the leg so they know that you recognize that. And then 20% of people aren't securing the bag on the bed frame. It needs to be on the bed frame, not on the side rail.
Hi, Mrs. Smith. I'm Carol. I'm your CNA. I am here to do some catheter care. We want to make sure you're all clean and you don't get any infections or anything, okay? I'm going to do some hand hygiene. And then I'm going to put on gloves. I've already got your bed flat, which is helpful when you're doing catheter care. Put on my gloves. Okay, let's see. All right, so your catheter bag is not strapped to your leg, so I am going to put the leg strap on because otherwise when you move, it can pull on that catheter, and that is not a fun thing. So let me just put this strap on your leg. Okay. Sorry, Mrs. Smith. Okay, so that's on. All right, now I'm gonna clean around the catheter. All these silly people, they put alcohol pads there and wipes, and I do not want to put alcohol around your urethra because that would hurt in a most unpleasant way. So I am going to hold on to the catheter so I don't pull on it. And I'm going to take a corner of my wipe and I'm going to wipe around the meatus. I'm going to fold the wipe another direction. Wipe around the meatus. Use a different part of the wipe. Wipe down the labia. Different part of the wipe. Right down the labia. Then I'm going to get another wipe. And I'm going to hold the catheter right here and I'm going to wipe 4 inches away from the labia. I'm going to use another part and I'm going to wipe it again. Okay, so I've got all that clean. I'm going to put that in the garbage. And then I'm going to check and make sure that your catheter bag is where it belongs. And it needs to be on the non-movable part of the bed frame. And so they actually had, somebody left it on the side rail, which is the wrong place. So I'm going to put it right here on this hook so that it doesn't pull. And then I'm going to cover you up. I am going to take off my gloves. I'm going to throw them in the garbage. I'm going to use hand sanitizer. And I'm going to leave your call light and your water in reach. Is there anything else I can get you? Okay, I'll be back in about an hour to check on you. All right, bye-bye.
Same goes with indwelling catheter care for a male. People aren't holding the catheter while they're cleaning it. They're not securing it to the thigh. They're not putting the tube over the thigh. They're not making sure it's on the bed frame. And they're not using a different part of the wipe. So if you miss enough of those things and you don't introduce yourself, then you've missed enough to fail that skill.
Indwelling catheter care on a male. Candidate is asked to provide indwelling catheter care for a male resident. Resident is lying in bed on a waterproof pad that has already been placed. Changing waterproof pad is not tested in this skill. A mannequin portrays the role of the resident. Hi, Mr. Smith. I'm Carol. I am your CNA today, and I am here to do catheter care. How are you feeling today? Good. Okay, I've done hand hygiene. I'm going to put on my gloves. Get my wipes. Okay, I'm just going to pull down this sheet so I can clean around your catheter. Let me know if anything hurts. So I'm going to use non-alcohol wipes because alcohol would burn. And I'm going to start at the meatus and I'm going to clean around the meatus. And I'm going to use a different part of the wipe for each time I clean. And then I'm going to clean the catheter. I'm going to hold it at the top so I don't pull on it, and then I'm going to clean 4 inches away from the catheter, from the penis. Then I'm going to turn it again, pull away, one last time with a different part of the wipe. Okay. I'm going to make sure that his catheter is taped down and that the tubing goes over the leg. I'm going to put his brief back on. I'm going to take off my gloves, throw them in the garbage, pull this back up. Then I'm going to use my hand sanitizer. Here's your call light, Mr. Smith. I've got your water and your cell phone on your bedside table. If you need anything else, you just ring your bell and let me know. Thank you.
log roll using a draw sheet, now we're up to 7% of people that get the skill not passing it. People aren't putting the bed flat. Well, it's a log roll. They've got to be flat. So make sure you put the bed flat. You've got to ask the tester for help, and then you've got to tell her what to do. You've got to make sure that you both grasp the draw sheet when you move them to their side, and you're telling the tester how to help you. And make sure that you leave a call light and water.
Log roll using draw sheet. Candidate is asked to change position of resident from semi-Fowler's to lateral position. Resident has chronic back neck pain, and turning is quite painful for them. Resident prefers to be log rolled when turning to reduce pain. A mannequin portrays the role of the resident. Hi Tiffany, can you help me do a log roll, Mr. Smith? Sure. Okay. Got my hand hygiene. Hi Mr. Smith, I'm Carol and this is Tiffany, and we're going to roll you over on your side, and we heard that you prefer the log roll because it makes your neck and back hurt less, and we really don't want you to hurt. So I'm going to start by taking you off of these pillows to get you in a prone, in a supine position. Okay, does that feel okay? Good. All right. Will you put one between his legs, Tiffany? Okay. On the count of 3, Tiffany's going to get the bottom of the sheet, and I'm going to get the top, and we're going to roll you on your side. Are you ready? 1, 2, 3. There you go. Okay. And we still got that one between his legs. Yep. Okay. And then I'll put one underneath his arm, but he doesn't have any arms, so we'll put it right there. Do you want a pillow under your head, Mr. Smith? Okay. Does that feel good? Okay. You let us know if you need anything else. We'll use some hand sanitizer. Here's your call light. I put your cell phone and your water right next to your bed. You call me if you need anything. You have a good day, Mr. Smith. Okay, did we get everything?
Conscious care, brushing teeth. People forget to put on gloves. They don't put them in a sitting position, and they don't clean and dry their mouth. Just little things. But enough little things to flunk you.
Mouth care, conscious brushing teeth. Candidate is asked to provide mouth care for a conscious resident who is unable to brush own teeth. Resident has his or her natural teeth. Resident is lying supine in the bed. The mannequin portrays the role of the resident. Hi, Mr. Smith. I'm Carol. I am here to help you brush your teeth. How are you feeling today? You know what? Let's put you in a semi-Fowler's position, and since your bed has a crank, we're just going to lift you up with these pillows and get you in a semi-Fowler's position. Okay, is that good? Okay, I'm going to put some gloves on. My name's Carol. I'm your nurse today. We talked earlier. Do you remember me? You do? Good. Okay. Would you like a clothing protector to make sure we don't get anything on your hospital gown? Over here. Okay, I've got some AIM toothpaste today, my fave. You like it? Okay. Got some water here. Rinse. Spit. All right, then brush your teeth. And I'm going to get your tongue. Okay. Give you some more water and let you spit. Is that good? Wipe your mouth off. Put some lip moisture on you. Did you want some lip moisturizer? You do? Of course. Thank you. Okay, does that feel good?
take my gloves off. Use my hand sanitizer. Here's your call light and your water and your cell phone's right next to you on your bedside table. You call me if you need anything, Mr. Smith. You have a good day.
Unconscious mouth care. You've got to put their head to the side. You've got to put a washcloth underneath their head. Clean and dry around their mouth. Lip moisturizer on them. Remove your gloves. Do your hand hygiene.
Mrs. Smith, I'm Carol. I'm your CNA. And I know that you are not conscious, but maybe you can hear me, so I'll just keep talking to you and telling them what I'm going to do. So I'm your CNA, I'm Carol. I am going to do some oral care on you to make sure your mouth's not too dry, okay? And if you can blink or move or anything and let me know if anything's bothering you, that'd be great. Okay, I'm going to put some hand hygiene, some hand sanitizer on. And then I'm going to put on my gloves. I am going to turn your head to the side so you don't aspirate. I'm going to put a washcloth underneath you, or a towel or clothing protector. And I've got a toothette and some water. I'm going to rinse it in the water, then I'm going to squeeze the excess water off the sides of the cup. And then I am going to clean all the surfaces of your mouth. Clean your teeth, top of your teeth, clean your tongue, the roof of your mouth, all that. Does that feel better? Okay, take that out. I'm going to wipe your mouth off. Put some chapstick on there. This off. Put your head back in a comfortable position. Take my gloves off. Perform hand hygiene. Okay, your call light is here, and you've got some water here, and I'll come back and check on you in about 20 minutes, okay? All right. Thank you, Mrs. Smith.
Occupied draw sheet change. Wear gloves. Put the bed flat. Again, how do you change a sheet with the bed up? No, put it down.
Okay. Hi, Garrett. My name's Claudia. I'm your CNA for the day, and I'm going to change your draw sheet. Let me sanitize my hands, and I'm going to put on a pair of gloves. And then I need to make sure your bed is flat. How are you doing today anyway? Doing good? Great, it looks like it. Okay, so I have my clean draw sheet here, and I've got it on the bedside stand. His bed is flat. And what we're going to do is we're going to roll the patient on his side and change half of the draw sheet first, and then change the other half. So I'm going to roll you on your side, Garrett. And now don't roll off the bed. Looks like you're good. And then I'm going to roll the sheet up.
Lateral position is a really easy skill to fail because it doesn't have a whole lot of steps, and you have to move the person towards you in 3 separate steps. You move their head and their shoulders, then you move their middle, and then you move their legs. If you don't move those three separate sections, then you lose points for 3 separate steps. And if you don't introduce yourself or leave the water or say what you're doing, it's enough to fail that. So make sure you move them in those 3 positions. We had a student that actually moved them in the 3 positions and then forgot to put them on their side.
Hi, Mrs. Smith. I'm Carol. I'm your CNA. I am going to turn you on your side. Is that okay? Okay. Put some hand sanitizer on. All right. Got the bed in a flat position. You are all skillwampus. Okay. I'm going to move you over to the side of the bed so that I can move you to your side. So I'm going to start with your head and your shoulders, and I'm going to move you towards me. 1, And then I'm going to take your middle and I'm going to move you towards me 2. Then I'm going to take your feet and I'm going to move you towards me 3. This is a most flunked skill. If you don't move them, and you don't introduce yourself, that is enough to fail. So don't forget the move, move, move. Okay, so I've got you moved over. Now I'm going to get my pillows. Got a whole bunch of them. I'm going to put a pillow between your knees. Put your arms over here. And I am going to roll you on your side. Okay. And I got a pillow behind your back. And readjust this pillow by your knees. I'm going to put a pillow under your arm. Okay. Now I'm going to cover you up. I'm going to use my hand sanitizer. And I've got your call light and your water over here within reach. Is there anything I can do for you? Okay, I'll come back and check on you in half an hour. Thank you.
And the last skill you can get is pivot transfer to the wheelchair, from the bed to the wheelchair with a gait belt. And the same as the other gait belt ones. Make sure you lock the wheels, make sure the gait belt's snug around the waist, make sure their feet are flat on the floor, and make sure you do hand hygiene.
Hi Margaret, I'm Whitney. I'm your CNA today and I'm going to help you pivot transfer to your wheelchair, alright? Sounds great. So I'm going to do my hand hygiene. And then we're going to take this gait belt, put it around you. Make sure it's snug. Alright, and then we're going to lock the bed wheels. And then the wheelchair wheels as well. And make sure you have non-skid shoes on. Then I'm going to help you lift up. Okay. This from your front here. And so on count of 3, we're going to go and stand up, okay? Okay. 1, 2, 3. Then we are just going to do a little pivot, sit back down, and then we're going to make sure your hips are good and they look good. Then we are going to take off the gait belt. And then I'm going to do my hand hygiene again. I'm going to leave your call light and your water in a reachable place. Wonderful. That's great.
That's a wrap for all the skills, and now we'll start practicing them today. Each person needs to do each skill. Tomorrow you'll do a little pass off on the computer that we can check and make sure that everybody's done every skill. But you've only got 2 days to practice these skills, so make the best use of your time practicing the skills while you have access to all the equipment. And as you get through today and your next lab, you'll see that it's really not as overwhelming as it looks when you're looking at that skills handbook going, holy Toledo, how am I supposed to learn all this? Well, all the beginning and ending procedures are the same. You got, hi, I'm Carol, I'm your CNA. I'm here to blah, 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 blah. Let me put my hand hygiene on. And then I just got to remember what's in the middle, because in the end is going to be call light, water, and hand hygiene again. So have a great day practicing.